Hi, I'm Gabby Karatka, a first semester nursing student, and today's date is 10/21. I will be doing an enema today. So the first thing I will do is gather all my equipment, and I'll check for an order for the enema. Then I'll perform hand hygiene as I walk in the door. I'll introduce myself. Hi, Mr. Smith, I'm Gabby, your nursing student today. And I'll check his name and date of birth, and I'll explain what I'm going to be doing today. I'm also going to ask him when his last bowel movement was. I'll also assess his abdomen for any distensions and listen to his bowel sounds, as well as check for his immobility or mobility, depending. I'll use a bedpan or a bedside commode or just the toilet. I'll also provide for privacy at this time and put on my gloves. And I'm going to go ahead and I have my enema bag here. I filled it with 500 milliliters of warm water. So I'm going to go ahead and prime the tubing at this time. I'm just going to do this in the trash can. Okay. So after I prime the tubing, I'm going to go ahead and set up my waterproof check underneath my patient. I'm also going to put a bath blanket over him, just exposing the area I need. Then we'll go ahead and grab my tube once more and go ahead and lubricate it 2 inches. And now I'm going to go ahead and reposition my patient to the left lateral position with the right knee flex. So I'm going to go ahead and lift up the upper buttocks and go ahead and tell my patient to take in a big deep breath as I insert the tube 3 to 4 inches. If I meet resistance, I can go ahead and slowly unclamp the tube a little bit to let some of the enema flow and push in a little bit more. If I still meet resistance, I'll take it all the way out and tell the physician. After doing so, I can move my bag down to hip level and slowly unclamp my tube, slowly raising up 12 to 18 inches to let that enema flow. If my patient experiences any cramping, I'll go ahead and lower it again and clamp my tubing and slowly unclamp it and higher it again. Once it's all done and the enema is completely emptied, I can go ahead and clamp my tubing once more. And I'm going to go ahead and tell my patient to take a big deep breath outwards as I remove the tube. And I'll fold this all up into my disposable towel. Throw that away. Take off my gloves. And I'll cover my patient back up. I'll tell him to have the enema for at least 5 to 15 minutes, and I'll give him his call light to let him know when he does need to use the restroom, that I'll just call that and I'll come back and assist him to the bathroom. I'll then go ahead and document the type of solution, how much input there was of the solution, and what his bowel looked like. And then I will also go ahead and reassess his abdomen at this time.